Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Okay, right. So, in the peptic ulcer, first peptic ulcer, right? Treatment of peptic ulcer. Okay, for the treatment of peptic ulcer, we can use proton pump inhibitors. Should be used for the treatment of peptic ulcers. So, in the proton pump inhibitors, actually, proton pump inhibitors are the most potent anti-secretory agents or they are substituted benzimidazoles. They are most potent anti-secretory agents or they are substituted benzimidazoles which are called as proton pump inhibitors. These proton pump inhibitors covalently bind to the catalytic subunit of proton pump, and these proton pump inhibitors provide they cause inhibition of acid secretion. Obviously, they will bind to the catalytic subunit of proton pump and thus they inhibit the acid secretion. Okay, and one important thing is they will covalently bind to this proton pump and thus it causes irreversible inhibition of the enzyme. Okay, this proton pump, when they bind to the proton pump, this will cause irreversible inhibition of the enzyme, thus inhibiting the acid secretion for more prolonged time. Thus, they will inhibit the acid secretion for more prolonged time. Then, next, these proton pump inhibitors are also more effective during the day and thus they are generally prescribed before breakfast. They are more effective during the day and thus they are generally prescribed before the breakfast. One important thing in proton pump inhibitors are they are required, an acidic environment is required within the gastric lumen for them to become activated. Within the gastric lumen, they require an acidic environment to become activated. So first they require gastric environment for them to become activated and then they bind to this proton pump and they irreversibly inhibit the proton pump and thus they inhibit the acid secretion for more prolonged time when compared to the other types of anti acid secretory drugs. So one important thing is when you give acids or H2 receptor antagonists, if you give acids or H2 receptor antagonists along with proton pump inhibitors, what these acid and H2 receptor antagonists will do is these acid and H2 receptor antagonists will cause a see these acid and H2 receptor antagonists will actually inhibit the acid secretion. Because they inhibit the acid secretion, they will cause alkaline environment. Okay, they will produce an alkaline environment. And these proton pump inhibitors, they will actually require an acidic environment for activation. So because there is alkaline environment is present, so as a result, because of this alkaline environment, there is no activation of proton pump inhibitors and thus there is no action of proton pump inhibitors. So thus you should never combine antacids H2 receptor antagonists with proton pump inhibitors.
thank you and thank you for watching.